Hello, I'm Julia Walters with Kingman Regional Medical Center. You're watching our COVID-19 video series, designed to keep our community and staff informed about issues surrounding the COVID-19 pandemic. In these videos, we'll talk with relevant subject matter experts about our policies, protocols, and status as we all work together to stay safe and healthy. Today, we're talking with Jim Wells, KRMC's Chief Nursing Officer, and Cheryl Porter, KRMC's Risk Manager. Jim's going to get started by telling us about our COVID-19 status in the hospital.
Thanks, Julia. I wanted to give you some updated numbers where we stand with our COVID volume in the hospital. Today we have a total census of 127 with 13 patients in ICU. We have tested a total number of 5,139 patients with 323 of those coming back positive. We have about a 6% positive rate. We have currently 27 patients that are in-house that are positive or rule out isolation. I also wanted to take just a minute to thank the staff, all of our staff here at KRMC, for all the additional work and time that they are putting in to help care for our community as well as other patients that have been transferred in. So from the bottom of all of our hearts, we certainly thank you for the sacrifices that you're currently making during this crisis.
Thanks, Jim. Now our risk manager, Cheryl Porter, is going to tell us about the Arizona Surge Line and our masking policy and what this means for our hospital. Go ahead, Cheryl.
Thank you, Julia. So I'm going to talk about the Arizona Surge Line. It is a statewide patient sharing program to shift patients from hospitals that are getting an influx of patients more than what they can care for to hospitals that still have capacity to take patients. COVID has peaked in quite a few other communities, and we have been able to take on a few patients to help them out. We do continuously evaluate our staffing and available bed situation to make sure that we are in a position to safely take patients. If we're full on beds or don't have adequate or additional staff to care for the transfers in, then we'll decline that request, and that's fine. They allow that. The program works to really balance the statewide demand so that all patients are able to get the care that they need during this time. And it does allow us as a participant, if we ever did get a surge that overwhelmed our hospital, we would be able to transfer patients to communities where they could get care. The other thing that we just want to talk briefly on are the mask situation. There's a lot of debate about masks and their effectiveness in slowing or preventing the spread of COVID-19. We're not asking people to think or feel any particular way about the masks. We do, however, want to let you know that KRMC is following the most current CDC recommendations and respecting our local and state government officials' request that masks be worn. Masks are required in public areas of the hospital and all campus, as well as in patient care areas of all of our facilities. This is to contain the spread from non-symptomatic people from accidentally spreading the virus to other individuals. And we do believe that this keeps our staff and their families, as well as patients we serve, safe during this uncertain time. And we appreciate your support on that and compliance.
Thank you, Cheryl. To learn more about COVID-19 in our community, follow KRMC on Facebook or visit our website at azkrmc.com/COVID-19.